Okay, good afternoon, everyone. My name's Andrew Scopes. I'm a councillor for the Beeston Holbert ward in Leeds, and I'm the chair of the Adults Health and Active Lifestyle Scrutiny Board. I'd like to welcome everyone here in person and those watching online, either now or later on. And we've got an important meeting, as we always do. As you will know, I always like to warn you that this meeting is being recorded and streamed live for the benefit of the wider public. I'm going to start by asking people to introduce themselves. Firstly, I'm going to ask board members to introduce themselves, and then we'll ask guests to do that shortly after that. So, as I said, I'm Andrew Scopes. I'm a councillor for the Beeston Holbert ward, and I'm the chair of the Adults Health and Active Lifestyle Scrutiny Board. So I'll go to my left. Thank you.
Councillor Stephen Holroyd, Ardsley and Robin Hood.
Councillor Bromley, Horsforth and Rawdon.
Good afternoon, Councillor Kevin Ritchie, Bramley and Stanley Ward.
Good afternoon, Councillor Taylor from Chapel Allerton Ward.
Good afternoon, Councillor James Gibson, Crossgates and Winmore Ward.
Good afternoon, Councillor Mahaley Francis-Mayer for Moortown and Mewood.
Good afternoon, Jane Mashenko from Health Watch Leeds.
Councillor David Blackburn for Farley and Wortley.
Councillor Stuart Galton, Rothwell Ward, substituting for Councillor Lay.
Councillor Lynn Buckley, Allwoodley Ward.
Ryan Stevenson, Councillor for Harewood, substituting for Councillor Caroline Anderson.
Good afternoon, I'm Angela Brogden, the Principal Scrutiny Advisor to the board.
Thank you and welcome everyone. Okay, so we'll start by going through the first few sort of regular items of business. So I'll ask Angela to talk us through those ones, please. Thank you.
Thank you, Chair. In relation to item 1, there are no appeals against the refusal of inspection of documents. Under item 2, there are no items for exclusion of the public. In relation to item 3, there are no late items, and under item 4, please may I ask if members have any declarations of interest in accordance with the Council's Code of Conduct. And I shall take silence as none. Thank you. And in relation to item 5, we have received apologies from Councillor Anderson, with Councillor Stevenson attending as substitute member, and Councillor Lay, with Councillor Galton attending as substitute member. Thank you, Chair.
Super. Thank you very much, everyone. Okay, I'm going to start with the minutes of the previous meeting. So firstly, are there any matters of accuracy that any member wants to raise? In which case, are we happy to approve those minutes as a true and fair meeting? Yeah, thank you. I'm hearing yeses for those who are watching online. Okay, so matters arising. Angela.
Thank you, Chair. It's primarily in relation to minute 29, which is the CQC inspection of the maternity and neonatal services at LTHT. Further to the board's consideration of the matter in July, it was agreed that the board would continue to monitor this issue closely, with board members receiving regular written updates from the trust. So the first of these updates was circulated to board members on the 5th of September. Alongside this, I also circulated a copy of the briefing paper that was produced by Health Watch in relation to people's experiences of maternity and also preconception, with a focus on health inequalities. And I understand through you, Chair, that the request of the board is that we'll continue receiving the written updates every couple of months. Thank you.
Thank you very much. So just for those who weren't there and for the public, we had a discussion about how often we want an update in the pre-meeting, and it's agreed we'd ask for it every couple of months, and we will continue to monitor whether we need another in-person meeting with the hospital. Councillor Mahaley France.
Sorry to interrupt regarding that agenda item, but I think it's important to also get an update with that agenda item on maternity care, about staff wellbeing and care, and the culture that surrounds that area as well. Thank you.
Thanks for that, Councillor. I think you're absolutely spot on there. The culture and the work environment were key considerations that we made at the last meeting. So yes, thank you for that. Okay, any other matters arising that any board members want to raise at this point? No? Okay, so we're going to move on. So let's start by having our guest people introduce ourselves. We'll start over here and we'll go around and introduce everyone that hasn't introduced themselves, and then we'll get introduce the item. Thank you.
Hello, everyone. My name's Tim Riley. I'm the Accountable Officer for Leeds Place of the West Yorkshire ICB.
Hello, I'm Helen Lewis. I'm the Director of Pathway Integration at the Leeds office of the West Yorkshire ICB.
Good afternoon, everybody. Caroline Barrier, Director for Adults and Health at Leeds City Council.
Hello, everyone. Victoria Eaton, Director of Public Health at Leeds City Council.
Super, thank you very much. Just for the guests, if you want to move your box a little bit closer to you, then we'll be able to hear you a little bit louder. Great. Okay, so the first item is the local implementation and impact of NHS reforms. So I'm going to ask, I think Tim's going to introduce his paper. You can assume we've read the paper, but if you've got some opening remarks, please make them. Thank you.
Okay, thank you. Thank you for the opportunity to come to the scrutiny board today to talk through all the change that is happening across the NHS at the moment. We are certainly in a period of significant change, and this is by no means complete. I would actually say it is just started. At the heart of it is the 10-year health plan. I think really importantly, you often hear it described as an NHS plan, but its actual title is health, and health is broader than the NHS. And I do think that's important to remember. I think also the word plan is interesting. In many ways, it's visionary and strategic, and a lot more detail will need to be and is expected to be published over the next few months and indeed potentially years. We are expecting considerably more to come through in the autumn as part of the NHS planning round. So whilst it has that designation of a plan, there are some challenges with that in the lack of detail in some parts, the lack of clarity around resourcing and so on that you would normally associate with a plan, but we are expecting some of that to come through. The paper sets out, I think, some really positive things that are there within that 10-year plan. I know in Leeds we have a real focus and have done for a long time around communities and neighbourhoods and localities, and we use various language in different settings, but that same essence, and that is certainly there at the heart of what is being asked for. There are a number of other really important pieces of it within this, which I won't go into because I know you've read the paper. But I guess as well as welcoming those positive things, there are some cautions that have been understood nationally and locally. I've mentioned a couple of them already, but I think the feasibility of delivering some of this change is a real challenge to both the health service and wider local authorities and other partners across Leeds and indeed across the country. What I wanted to do then was draw out a couple of areas where we are starting and have already, if you like, got slightly ahead of that 10-year plan. One of those is around neighbourhood health. Lots of work being done as a city across the partnership with colleagues from local authority, NHS providers, third sector, our GP practices and primary care networks. And part of that is we submitted a bid at the end of July to be a national pathway neighbourhood test site, and really good news, as we've heard today, that we have been selected as one of those. That's sort of news hot off the press. So I think there were nearly 150 applications, 43 which got accepted, and we were one of those. So that's really positive news for Leeds, and will provide us with some additional support in terms of sharing good practice, understanding what other parts of the country are doing, as well as, I think, and what we've learned already, is helping us to get truly focused. What I would want to say around neighbourhood health is two really important points. One is the bid is quite narrowly defined and covers a certain population, just under 250,000, which is by no means the whole population of Leeds. This is the first stage. It's not a pilot to see if it works. It is the first stage of a rollout to the whole city. Every part of the country is meant to have this neighbourhood health model. The second thing is, whilst the NHS has a critical role in this, both as a city and I think nationally, we understand that this is about health, not about the NHS. So really importantly, in what we're doing, we're not thinking about neighbourhood health as a purely NHS function. It is not just a transfer of NHS services. It's about how we can in communities work really differently. The second area that we are already on with, this was initiated by West Yorkshire ICB and Rob Webster just before some of the changes that we're now in the middle of were announced, was to ask local providers and councils to work together to see how we might build on the success we've already had as a partnership and take it into the next level. I think it's particularly pertinent because with the changes to ICBs and the moving into a role of strategic commissioner at West Yorkshire, it's going to be really important that in Leeds we have a strong partnership that can take the responsibility for managing NHS resources along with the council in the way that we've done already well in Leeds and would want to continue to do. We've started that work. Again, we're in the middle of engagement and are just starting to develop some of those plans. And I'm sure in due course, once those plans have developed a little bit further, we'll come back to scrutiny to talk through some of that, particularly our provider colleagues and Leeds City Council colleagues. But I thought it was really important that you knew we were already in that phase of responding to what was in the 10-year plan. Indeed, I would say the 10-year plan reflected our ambition rather than the other way around on that one. The final piece just in the paper is around the ICB and the changes to ICBs. When we first, the chair and I agreed this date first, initially, I thought we'd be right in the middle of full scale, if not, full engagement and consultation with staff about the changes. We were set a very ambitious deadline that we had to have reduced our total capacity in West Yorkshire ICB by, in our case, 45% by the third quarter of this year, i.e. before Christmas. And that timetable has slipped considerably for reasons set out in the paper, not least, and you will have picked some of this up from national press and so on, the lack of funding and understanding of the scale of redundancies that would be needed. So we are in a slightly different place. What I have set out there is, as far as I can, given sort of some of the sensitivities around this with staff and other colleagues, things that we have discussed with our staff and really describing both the planned role of ICBs as strategic commissioners and how in West Yorkshire we intend to take that forward, ensuring that there is at least an integrator function still in each place working with Leeds City Council and some of our NHS provider, general practice, third sector colleagues. So I hope there's a lot of risk in all that. And we're waiting to see whether the issue around redundancy costs will be addressed in this financial year or next. And I think at the moment that remains unclear. So we have paused staff consultation indefinitely until we hear otherwise. On a positive bit of news, second announcement today, you will see in there one of our conditions was the regional blueprint was published. That was finally published today. So we do have one of our three conditions now met before we would proceed. I hope that's a quick canter through quite a lot, but I guess the questions are probably more important. So I'll pause there and back to you.
Super. Thank you very much, Tim. And thank you for the paper. I think it's really helpful to set out the in the paper is a 10-year health plan summary. And I think what you say about health being much broader than the NHS, it's certainly something we think as the city. So I think that does match what we believe. So that is good. Members, if you want to ask questions, please indicate in the usual way. I'll start with Councillor Gibson, and anyone else who wants to indicate, please let me know.
Thank you, and thanks for your report. I know it's going to be an incredibly challenging time for you. You were right in everything that you said. You know, this is not a plan as such; it's a vision. And I commend the government actually for grasping the nettle, because for a long time now, you know, we've all sat here and talked about the NHS struggling. That we need a radical shift in order to save it. It's a conversation, it's a national conversation. It's not just a conversation amongst professionals. And this government is taking the radical steps, in my view, that it needs to do in order to to ensure that the NHS is with us for the long term. I mean, you know, the overall aspirations are things that we've talked about here in committee for years now. Hospital to community. We've already talked about what we already do as Leeds. It's great that that'll be turbocharged. Analog to digital. Great, and I'll come on to that, some of the positives with that in a second, and sickness to prevention. Again, something that we, at every committee, we always talk about, but unless you have a thorough commitment from the government and able to enable that with hopefully funding as well, you're never really going to be able to achieve it. It takes a lot of commitment, both political and in capital as well, in terms of financial capital. Some of the big headlines for me that I'm, you know, to get excited about the NHS app and booking appointments. So, you know, a lot of people when they do hear about this, or when this comes online, mental health therapy has been able to book online. Everybody knows the difficulties that people have with waiting on waiting lists for months, if not years, for mental health therapies. So, and sort of not being updated with that as well. So being able to have that at people's fingertips is going to be really positive. Prescriptions we're already there, and for a lot of people. Physio, again, people understand the long waiting lists and the difficulty. Even podiatry as well, which is great. Neighbourhood health centres, to me, are going to be transformational. I think they're absolutely wonderful. It's a wonderful idea. Of course, they need the capital to invest, but you know, the idea of having GPs and nurses and social workers and even debt advisors in one place could really transform the way that people see health and wellbeing services in the country, and massively to be welcomed. The new mental health emergency units, dentistry as well has been grasping this, and we didn't talk about that really in that opening as well. And hopefully new GP, new contracts and getting rid of UDA. So a lot of positives. However, I do recognise the negatives. Well, not negatives, but the big question marks, and that's where I have the questions for you. Social care for me isn't mentioned enough in the 10-year health plan. I know that we're waiting for the Casey report. You know, that's not until 2028. But if you're sort of rolling out a lot of the work that's being done, and the timetables within the 10-year health plan come online in 2028, but yet we won't have a report for how we're going to transform social care until that time as well. So how are we managing that? You've already touched on ICBs, but also NHS England as well, and you know, we've recently learned that the King's Speech is going to be delayed, so the timetable as well for when the NHS England is going to be legislated out, if you like, is going to be delayed. So how are we sort of managing that? And the devolution bill as well, and strategic authorities, and how is that going to work? Obviously, you know, a lot of the things that the NHS Health 10-year health plan is trying to achieve in terms of tackling health inequalities is reliant on a real joined-up approach at that strategic level. What conversations are already happening? I know, you know, we're ahead of the curve on that in Leeds as well, but there's likely to be more powers being devolved to Leeds, similar to the model that we've seen in Greater Manchester. And finally, I'll declare an interest in patient voices here. I think there's a big shake-up on patient voices. Maybe the representative from Healthwatch would like to talk about that more. But I think, you know, if there's one really negative thing in the 10-year health plan for me, I think actually is removing patient voices by getting rid of Healthwatch England, both at a national level, but also at a local level as well. And we, you know, I'm sure everybody on this committee will recognise the vital work that Healthwatch Leeds has done over the past 12 years now. Is it 12 years? 13 years to represent patients' voices and make sure that actually the lived experiences of patients is represented at this level, but also at senior levels as well, and make a real difference. So how are we going to manage that? I know some areas are contemplating whether or not the organisation can continue in some form and supported by the ICB and local authorities.
All right. Thank you, Councillor Gibson. I'll just start, if I could, where you finished. I would agree, and I think the health service generally on the ground, and certainly in Leeds and across West Yorkshire, is really concerned about some of the recommendations around patient voice, particularly the loss of an independent voice, which Healthwatch coordinated and brought. yes, quite rightly, individual organisations and so on in the NHS need to make sure we listen to patient voice and the public voice, but that's not independent. And I think some of the things that have happened, even in Leeds recently, remind us just how important that independence is. So I would hope, and I know conversations are happening both in Leeds and more broadly about, okay, we might not have a statutory vehicle called Health Watch, but what are some of the alternatives to how we might approach that? So echo your comments on that. In terms of social care, we clearly in Leeds work really closely together, and I think there's a commitment across West Yorkshire. We work well with our local authorities generally, particularly compared with other parts of the country. There's no intention that would change. One of the things we are waiting for is some changes to the Better Care Fund that are planned for next year. We're waiting for some guidance around that, and you'll see that mentioned in the report. I think that may well contain some sort of precursors to making sure that we continue to work really closely with colleagues, particularly in adult social care, around this agenda. It is one of the gaps, and as speaking as an NHS person, it's probably one of the biggest concerning gaps. If you ask someone from the NHS what mattered most to success for the NHS, there are probably two things. One is reform of social care. And additional support. I don't just mean reform. I think that the capacity strain is enormous. And then the second thing was around public health. Without a healthy population, the NHS gets overwhelmed. So we've seen a bit of the public health in there, but not enough on social care yet. So recognise that. In terms of managing this period of transition, we obviously have a set of good structures in Leeds. We work together as partners. We keep everybody informed. We've also established at a West Yorkshire level a transition board because I think as this has gone on and some of the delays have become apparent and some of the timescales, quite understandably in things like the 10-year plan it's 10-year. I mean, they're long timescales. We've recognised none of this will happen overnight, and there will be periods of transition between an old way of working and the new ways of working and emerging. So that transition board has got representatives not just of the ICB but other partners, including local authorities right across West Yorkshire, meets on a monthly basis, actually has involved NHS England as well, from the region, to be part of that board, and that their job is to oversee some of those some of that change and that longer period of transition. But nevertheless, I wouldn't want to underestimate how difficult it is at the moment. It remains extremely challenging. The final piece, particularly around health inequalities, Leeds will continue to do the work that we do, recognise particularly importance of the combined authority and our alignment there. ICB boards from April will be expected. The mayor will be a member of the board of the ICB. That's part of the changes that are being put forward. And we certainly work closely with West Yorkshire Combined Authority already, and have a number of joint posts in critical areas, include around public health and health inequality. And there's no intention to change those. We'll maintain those. Hope that's okay.
Thank you. Do you have a supplementary, James? Councillor Gibson. Thank you. Okay, I'm going to bring in Councillor Galton next.
Thank you, Chair. If you'll allow me, I want to focus on specific aspects, and I'm interested in particular around the concentration on things being made more local. You use the word local, place, community, and the reasons why those resonate with people is it should be about individual people having better access to the healthcare that they need when they need it. And unfortunately, some of the changes that are there, I think are bringing up some really major concerns. The first one, of course, is how do you expect some of the biggest fundamental changes in how you deliver care? How do you do that through an organisation which is going through significant trauma because it's losing half of its workforce? I don't envy that at all of you. But you do have very strong partnerships, as you've pointed out before, within local authorities. And I'm hoping that those local authorities can add some capacity to covering some of the concerns that I'll talk about. So first of all, issues around neighbourhoods. It talks in here about how local care partnerships are successful in Leeds. And it talks about the Neighbourhood Improvement Board as well. What I will point out to you is Leeds is a very diverse city, not just in demography, but also in geography. And most of the good examples that you can draw upon tend to be areas where the council has concentrated a lot of effort and it has prioritised resource into certain neighbourhoods, whilst others have looked on and have not received that. So what might be excellent in terms of local care partnerships in some of our inner city areas, I can assure you in the outer areas, they have been left undeveloped and neglected. And therefore we should not pat ourselves on the back and assume that we have consistency across the city. And in these local frameworks, I'm assuming there is going to be some kind of accountability to ensure that we do strive to have better consistency across the area, and that where there are differences, that we strive to make a difference. I'll give you one example. So where I am, and I know colleagues have the same kind of demography, we're on the edge of the city. I read somewhere recently that Leeds is 2/3 countryside. And we need to remember that when we're accessing health services, oftentimes, most of them are concentrated in the very urban parts of the city. And that people in outlying areas have difficulty accessing care because there aren't the buses that there were to get to their health appointment. Some of them might be associated with other health authorities. So, for instance, for me, a lot of people in Rothwell are referred to health services in Wakefield. When they look at their efficiencies and where they put placements and treatments, oftentimes it gets spread out over Wakefield district. So there's a perverse element where somebody who is reliant on public transport, who is in their 80s from Rothwell, is expected to traverse the public transport system to get to South Elmsall, to get to treatment. That shouldn't work. And that's where I have a fear that the technology-based solutions that are mentioned here to get more effective treatment might be more effective for the NHS commissioning bodies, but they might not be more effective in practice for the people that are meant to be accessing those services. And when it comes to local neighbourhood care centres, I am concerned that the council, in the proposal that it's put forward, is concentrating itself on assets that it already owns and has done plenty of development on in terms of delivering local integrated services. And it's primarily around, I'm trying to find the page now, around PCNs in Chapeltown, Bermontoft, Hare Hills and Richmond Hill, Beeston, Middleton and Hunslet, and then East Leeds communities of Crossgates, Seacroft and York Road. I appreciate that we do a lot of really good work in areas of high deprivation, but we need to think about accessibility to care is not just dependent upon your income. Accessibility to care is due to your geography and also your demography. And there are significant high populations of older people in the outlying areas of the city who have poor transport connections, might not have access to their own care because they can't drive anymore. And they need to have some kind of focus in terms of that delivery of healthcare near to them. And what's been put forward and has been accepted is very much focused absolutely on inner city areas and not on those outlying districts. And one of the things I'd like to see mentioned in here as well, Chair, if you don't mind, just following the pattern that's been set, is well, I'd like to know what is happening with asset management. Because one of the things that I pointed out here is you're looking at things you already have. Whereas if you're going to have real neighbourhood treatments, you need to be creating something in other communities. And we need to be perhaps thinking about having a moratorium on selling off assets that are within communities that might be needed for this very valuable NHS infrastructure going forward. Because we've had really bad experience in Rothwell, where our local GP practices asked the council to hold on to our local council offices because it was the only place they could expand into with the finance that they had. And the council said, if they want it, they can bid for it, instead of thinking, yes, we should be taking into consideration what our partners need. So I think there needs to be a little bit of a cultural turnaround in how the council approaches its partnerships with people like the NHS. And lastly, Chair, if you don't mind, I want to think about accountability, because you've just talked about how there's going to be boards at a West Yorkshire level, and then there might be one at a Leeds level. Where are we going to have the accountability for these local neighbourhood care delivery points for the localities that they're meant to be associated with? And are we actually going to be honest about what's needed in those areas by actually allocating them some specific resource to deliver that are locally based and also have a budget associated with them, particularly in terms of preventative health? So I think that would be a start of a 10 for me. Thanks, Chair.
Thank you. Started for 10. I think a couple of really important points and I'll speak. I can speak from the NHS perspective. I'm not able really to speak from a council perspective, and I don't think I should. Colleagues may want to answer some of those points. I think from an NHS perspective, what we've done traditionally in Leeds, working with colleagues and the council, is we have done what we can do without that commitment and will and financial flows being prescribed to work with communities. And we have focused and tended to focus on some of those most challenged in terms of their health outcomes. And that focus on health outcomes doesn't go away. The greatest inequality is not inequality of access, it is inequality of outcome. And we need to continue to stay focused on that. However, what is really strong about the 10-year plan is that over the next few years, every neighbourhood, and it is not just those in the more urban areas, every neighbourhood across England and certainly across Leeds is expected to have that neighbourhood health type system. So I think, which I believe is right. You know, I live in one of those more leafy parts of, well, it's actually of Bradford, but that's where I live. And I can completely see why it is important that every neighbourhood has access to the right sets of things. There have been some progress towards that, but this will take some time. One bit I will just say, and I do recognise the demography and geography thing. This is not only about inequality. It isn't only about deprivation. There are definitely significant issues, particularly for older people. And the digital answer, I think, I flagged in the paper that we would have a concern in Leeds, particularly around digital inclusion. And a full rollout of a digital solution to everything without regard to those who couldn't access it would not work. It would drive inequality, both demographically and from a deprivation point of view. In terms of assets, one of the things we want to do and start to really test as one of these 43 sites across England is how we do look at the assets in a different way. So from a health service point of view, I think at the moment we have very limited capital. We have no capital for community investment, hardly at all. We don't certainly have capital to purchase new buildings or anything like that. So we are having to look and work with national government and local government to say, well, what is some of the solution to that? So your asset point is understood. We are, and I know the our city estates board, that's sort of a joint health and local authority piece. One of the things we've pivoted them to say, you need to focus on neighbourhoods. That's where your concentration of effort should be. But I can't answer for City Council in terms of your decisions around assets. I don't think that would be appropriate. From an NHS perspective, there is definitely a challenge about assets in community and our lack of access to capital for primary and community care. Our access to capital, full stop, is limited.
Do you have a supplementary, Councillor Garton?
No, thank you, Chair.
Thank you for that. Okay, I'm going to bring in Jane next, please. Thank you.
Thank you. Thank you for the recognition of the need for something like Health Watch going forward, that independent and system approach for gathering the voices and taking them to places like this, really. I wanted to start by just saying, just recognising the impact on the workforce, you know, that they're going through. I mean, tremendous changes. Yes, the vision is there, but we're talking about people that are waiting, you know, they get a warning and then it's delayed and then it's delayed. And just to really heartfelt commiserations and, you know, feelings for them, and impacts yourselves, of course, Helen and Tim. It's not a pleasant place to be. And then I'd like to, you've recognised the risk of digital exclusion. I'd like to just kind of expand on that, because absolutely that's something Health Watch hears about, that actually, yes, whilst you and I may be able to navigate the NHS app and access appointments, etc., there are many people that really can't. They don't have the equipment, they don't have the confidence, the ability, the data. There are many, the language, there are many reasons that they are excluded from that route. And the other thing that made me concerned within the 10-year plan was it seemed to be really promoting the NHS app as a means of gathering feedback, and that being a really robust mechanism, which I would have really grave concerns if we were relying on that. We need to hear directly from everybody. We need rich qualitative evidence of lived experience, and we need it from people who don't necessarily leave it on apps and respond to surveys as well. So that's one point. I have a question, not just making a point. I do have a couple of questions. One is, which you've referenced in your paper and you haven't particularly brought out today, which I understand. I had the benefit of hearing this discussion in the Leeds committee recently, and I am worried about although the long-term plan is talking about partnership and working together, etc., the performance framework is very singular and very financial and very transactional, and not transformational, and not about working together across the system. And that's really risky to the partnership, and it's risky for addressing inequalities. Is there anything that you're able to reassure me that you're doing to counteract that? And then the second issue is a governance issue as well, and that is, if the place committee is not going to continue for that conversation about what's happening in Leeds, and it will ultimately be replaced by this partnership body, what's the timescale for that? We won't have a period where there's a gap, will we? That's it for me.
Thank you, Jane, and thank you for the recognition. Yes, I mean, it is incredibly challenging for staff, and I probably ought to almost reciprocate and say thank you, because colleagues are getting a lot of support from other colleagues in the city, and that's hugely appreciated. And I've been amazed personally just how resilient, robust and positive people have been in continuing to get up and do their job. And as this gets delayed, that gets harder and harder. So thank you for the recognition of that. And also do completely recognise the digital exclusion piece. I think it's really important for Leeds, as the kind of city it is, that's both hugely ambitious in terms of medical technology and so on, and has got considerable diversity and including deprivation, that we sort of pioneer a different approach and keep our eyes fully on that. In terms of the performance framework, thank you. So for those of you that don't know, the NHS England have published a new performance framework. The assessments were published today, and effectively it's a very rules based. So there's no sort of regions having a bit of a view. It's purely on where you come on a set of metrics, including finance, and all NHS trusts, community, acute, mental health, are placed in one of 4 segments currently. There will be a 5th, which may get moved into, but at the moment it's those 4. And the challenge, you've rightly said, is that then drives a certain set of behaviours that are very organisationally focused. We've had a number of conversations together about this, both as Leeds partners and also at a West Yorkshire level. And because I think of the maturity of the relationships in both Leeds and indeed in West Yorkshire, but certainly in Leeds, and our experience over time, there's a strong recognition that whilst one of us may get, have our performance metric specific to us, that nearly all performance metrics are connected to the wider system. So if you're an acute hospital and your A&E target is off, the answer is not in the hospital alone. It has to be in partnership. If you're a mental health trust and you've got some significant challenges around out of area placements, for example, part of the answer is about housing and the local authority. So you cannot achieve success without that alignment and engagement. So what the conversation I was just having this week with colleagues, sort of senior leaders across Leeds, was how do we make sure that our joint plans fully align in such a way that providers have the confidence that we are working together in each other's best interest. I do think that it will remain a challenge, and it is a challenge. It's right, it's one of those risks that we've highlighted that does not seem to sit with this integrated agenda. It seems to jar with it a little bit. Nevertheless, I would be confident that if anywhere can manage that, it would be Leeds, because we have a good history of, for example, Home First was in part response to Leeds teaching hospitals' struggles around emergency care. So we all collectively made those connections. In terms of the place committee for Leeds, so the anticipation is that at the moment the money for Leeds, NHS money, flows from West Yorkshire through me and the Leeds committee of the ICB to discharge those responsibilities in a partnership way. From next year, those committees will not exist, and the accountability arrangements for people like me will be different. And we are still working through a little bit what that transition year or two will look like. I'm keen, and I'm certainly pushing, and I'll continue to promote and challenge that if we're going to have successful place partnerships in the future, we can't go backwards at this point in time. And I think there's a good understanding from that of some members of the, many members of the ICB board, that we will need to at least put in a transitionary arrangement where Leeds people, leaders are making decisions for Leeds, not people outside of Leeds with the Leeds pound, if you like. So that's what we're advocating for. The exact timing of all this just continually slips, so it's really difficult to firm some of this up until we're clear what those timelines are. But I think it's important for Leeds to promote that, the criticality of a transition period where Leeds continues to have a say about, in effect, £2 billion of NHS funding. So at the moment, there's not a fixed answer, but the provider partnership bit is part of the answer.
Thank you very much, Tim. Just turn off your mic a second. If you turn off your microphone. Jane, do you have a follow-up question? No, great. Okay, I'm going to bring in Councillor Ritchie next, please.
Thank you, Chair. Thank you. Interesting discussion from colleagues across both sides of the table. I've got a simple, well, a question more than a long comment. I'm drawn to the risks, particularly the financial risks that you allude to. You talk about there's no substantial new investment, but I'm pretty certain I heard from the Chancellor that we've got record investment in the NHS. So could you perhaps expand on where the shortcomings are in the investment? You have alluded to the redundancy costs, which are kind of a one-off cost. And also you mentioned, and I agree with you, that social care, with it being about health and not just the NHS, is fundamental to supporting the whole health and NHS agenda. But we know that, so the council obviously picks up a lot of the costs of social care, and we know that appears to be continued pressures on the council funding as well. So yeah, that's what I'm after really. How the announced record spending on the NHS that I've heard then leads to this apparent shortfall for this transformation plan?
Thank you. The NHS, I've worked for it for 25 years nearly, is always blessed by having investment that I think other departments would envy. So I don't think we should underestimate or not recognise that. Where the challenge, I think, it comes is probably in three parts, and you've touched on a couple of those. There was substantial increase in pay, which was welcomed, both for doctors and for the wider workforce. And whilst that was an announcement last year, that continues to run right through into this year and of course forward. So a significant, if not nearly all, the increase went on pay, and positively, because I think recruitment's been an issue, retention's been an issue. I don't think that was a wrong thing to do, but I think we need to recognise that's where the majority of it went. There are two other really important points, and this is the vital link to local authorities and public health. Demand continues to rise because we still have, and I think the Lord Darcy report set this out, an unhealthy population, and therefore the demand for NHS health services is growing at a considerable rate in lots of different ways. We particularly talk about mental health, and we do see that, but also it's there in other parts. So whilst we continue to, we have had an increase in investment, part of the reason for that and the reason it gets absorbed is the demand for services is increasing and continuing to increase. It doesn't slow down. The third bit, which again you touched on, is social work colleagues across England, but I think I want to not quite exclude Leeds, are really struggling with meeting pressure for us to discharge from hospitals, for example. We do a great job in Leeds, and I think we're probably more integrated and joined up on this than in many parts of England and than we were a few years ago. Nevertheless, we are still spending as an NHS a lot of money on people in hospital beds that may not need to be there, and that remains a constant pressure for us. So when you take all those things in the round, it sounds like, we've got a lot of money. Most of it is gone before we've started. There has been, and quite rightly, a challenge from government, I think, around our productivity, and that work is important, and we are continuing to look at it very carefully. I think there are certainly opportunities if we work in a more integrated way, which is part of the plans and the work we've done, for example, around Home First is a good sort of first step of that, to release some of that funding, which we then can and could reinvest. But I think there is sometimes a little bit of a mismatch in people's perception of where that money ends up. A lot of it ends up managing increased demand and paying increased wages.
Thank you for that, Councillor Bromley.
Thank you, Chair. Yes, I also welcome this neighbourhood approach as we develop over the next 10 years. I'm just worrying about so in terms of when we do at the minute refer across to like third sector organisations during the NHS, it can sometimes be completely out of the area, and I think this has been touched on. When we're looking at bringing this locally, will we definitely be sort of niche with our understanding of what third sector organisations are in that area and could be available for referral, and also with an understanding that those third sector community organisations have probably come about from an already understood need by the local community and interest, so therefore there's a strength there too. And I am thinking in particular as well with assets that are in local areas such as outdoor nature and the environment, and so therefore looking at the sort of environmental groups that may exist that then could offer, and with our understanding that with community connection and well-being being part of all of that process for people's well-being and mental health that we've discussed. I also wanted to ask, just in terms of a little bit on that with the climate emergency and changing environment, although as a country we may not be able to see this anytime soon, but there does seem to be some evidence of change, and that there is potentially going to be impacts, and how we're going to integrate that into our predictions with this 10-year plan. And does that mean that there might need to be sort of a different reaction from what we have now in demanding of services? Thank you.
Thank you, Councillor. Welcome question around the third sector. It's such a strength in Leeds, and having come from other places to live and work here, really impressive. And ourselves, the NHS, along with the local authority, will continue to invest in infrastructure support to ensure that the third sector is able to play its part in the broader city agenda, and particularly that includes in neighbourhood health, because I think you're right. So some of our best examples, both locally and when we look internationally and nationally, what you see and understand is that the answer often to people's poor health is not a medical answer. It's a social answer, and it varies from community to community depending on what the makeup of that community is. And smaller third sector organisations are often the people who are in the best position to do that. With all the pressures on funding that everybody faces, no matter where you are in the system, that will continue to remain a challenge for all of us. But there is no way we can deliver good preventative health without the involvement of third sector and the communities that they sit in. It feels a really critical point. I was having to fill in a template just the other day about this, and for some questions that we're just looking through financial questions, as you do, and really wanted to emphasise the importance of the infrastructure support to third sector, so those smaller community organisations can engage in the right way to address what are perceived as health problems, but at the very least as socio-medical problems. They're not just medical problems. And in terms of health, we're going to have a long conversation, aren't we, about heat and climate and so on. It's going to be absolutely essential. I really welcome Victoria colleagues presented to the Leeds committee the report we're going to discuss shortly, and I think it's a fundamental issue in terms of how Leeds, or indeed the NHS more broadly, plan services, that we are taking account of some of those issues. Well, no, I'm not going to jump in and steal Victoria's thunder. I'll wait, because there's a really good graph in there that makes that point, and certainly the presentation we saw.
Victoria, did you want to come in just briefly?
Well, just to very briefly add, in the context of this paper, there's been several conversations about needing to make sure we're really joined up on how we work locally around neighbourhood health and on all of the agenda of the 10-year plan. I guess that the comment I'd make is that there's nothing new in the 10-year plan, which would sort of magically kind of mean that we do things, from scratch. This is a commitment to how we work in the city. There's hooks and levers in the 10-year plan around neighbourhood health that we can use to strengthen that. But actually, this is fundamentally how we work. On third sector organisations, the commitment to working with our third sector colleagues as part of that is strong. So a headline is that we spend 42% of our public health grant in Leeds in the third sector. That benchmark's relatively high. It's absolutely the right thing to do. And then my final point is on and it goes back to Jane's question before, the Department of Health and Social Care, as well as being responsible for the performance of the NHS, is also responsible for the performance of the public health function locally. So, and the blueprint that came out today for the regional office is really clear on that oversight of cross-sector working. So absolutely, that's wired into the system that we will need to report back to DH on our public health function and how that works with the NHS provider organisations. So I think it reflects quite a lot of points that have been made, but just to assure the board that is wired into the system. Thank you.
Councillor Bromley, did you have a follow-up?
No, that's brilliant. Thank you.
Great, thank you. So I can't see anyone else indicating, but I've got two comments and two quick questions as well. So the first one is the demographic change to society is the point you're making, Tim. As we age as a population, the reality is that has implications for costs and service needs. So even if we're not getting less healthy, an older population factually costs more to in the NHS sense than a population that's younger. Second point is around health inequalities, and I think the health inequality gap that we've been trying to tackle is the right thing to do, and we have to keep doing it. And then my two questions. So one is around neighbourhoods, and probably agree with Councillor Galton here around physical buildings and the need for them. So, and I think you've partly answered around there's not necessarily the funding for capital projects, but I think that's something that I would flag as a concern. So that's my sort of first question. And yeah, just in my ward, there's two NHS provisions that are not where we'd want them to be. One for maintenance cost reasons, one for investment reasons, which I think sort of illustrates the point. And then the second one is probably maybe a little bit niche. On the bottom of page 18, you talk about using genomics, which I had to Google to make sure I understood it correctly. It's around using the genes of patients to understand and identify possible risk factors. And I guess that rang alarm bells in my mind around data storage and data handling and how you're going to get it and where you're going to keep it and what you're going to do with it. And so just interested in your comments there. Thanks, Tim.
Yeah, thank you. In terms of the neighbourhoods and the buildings, I believe there's a really good understanding of the importance in some of the work that's being done nationally. And certainly we are in Leeds in terms of this first phase of looking at what's the next steps for neighbourhoods, because as Victoria's just said, we're committed to this and doing some of this already. We are looking at that question. What is interesting, I think, is some of the conversation that we've heard nationally about alternative funding models that are not entirely reliant on Treasury. That's a national conversation, and I'm interested to see how that might play out over the next couple of years. I think it's a really important conversation. In the meantime, the conversation locally has to be how we best use the asset we've got between us collectively. And that is not easy given all the funding constraints and everything else. And the NHS has very limited both capital expenditure and capital raising powers. So in that sense, I think we are a junior partner. Certainly ICBs don't own any capital. I mean, we rent a few buildings and we rent some desks at Merion and things like that. So we're not a sort of a leader in terms of understanding the estate, but it's something visible and tangible to people. And I think that matters. And I wouldn't want us to lose sight of that. In terms of the data handling, and I think we were all quite surprised about the emphasis on genomics in the 10-year plan. It's there. It's certainly a developing feature of what we are able to do as a society and as internationally. There are lots of questions, and we're still going to. This is an area where the detail is not there, and we'll have to follow in due course. I'm sure colleagues are aware there are a lot of conversations about how data is stored. The really important piece is that we continue to give the public and patients the rights to say what they want and don't want done with their data. And I think there's nothing I've seen in a 10-year plan or anything else that suggests that would change. There's some huge opportunities around this, around genomics. I don't want to lose it. I just want to make sure that we manage it in a way that either doesn't scare people, because I think there's such good benefits, but equally in securing people's information is going to remain a really critical part of how the NHS works.
It might just be worth adding there. Some of it sounds scary, but some of it is just happening now, which is just tailoring so that you get the right treatment. So instead of having a course of ineffective treatment,
by matching, that same course will be much more effective. So there's a cost effectiveness on a patient level, which I think is much less scary, but it's called that same terminology then covers the whole thing. So I think we're doing it now. Tailored medicines are based on genetic footprints, and that doesn't feel scary when your oncologist says, just want to see if you're this one or this one. That sounds okay. I think it's when you scale it up. So I think we do need to just kind of be mindful of the variation in the language, and I think some examples feel much more straightforward than others, and I guess it's just a word of warning that there's some very practical things that happen now that will put people much less at risk and have a much more effective, cost-effective outcome. So I think that targeting what we already know is probably one of the efficiencies and productivity gains that we can make relatively quickly. The wider, how do you use it for insight and planning, is a whole other thing.
Yeah, thanks for that, Helen. And I'm broadly supportive of using data. I guess my fear is more about who has access to it. And if you think about personal data that we used to treat as private, which is now on social media sites, I would say some of that's a little bit concerning, and who's buying that data, etc. But I think we'll pause that there. So I'm just going to bring this item to a close. I can see you, Councillor Galton, but you've had your.
It's not
your
a question,
chance.
Chair.
Is it a short statement?
It's a suggestion.
A short suggestion.
Yes, because one of the areas which has been raised by several people, as you just pointed out, is the issue around how this works out in a locality setting in terms of those neighbourhood centres. One of the things that the Environment, Housing and Community Scrutiny Board is looking at is how different council departments can be more responsive to community committees, and community committees do have champions on them who have responsibility for health and well-being. So some of that discussion around local assets and community accountability could be incorporated within what that scrutiny board looks at. So I'm suggesting that as perhaps a recommendation, or just noting that will be looked at in another scrutiny board, and other people are welcome to participate within it because it'll be a subgroup.
I think we can note that in terms of community committees may be a useful asset for local knowledge. It feels to me like we're quite early on in the process, and so I think I'd be cautious about making recommendations about the governance structure and how they listen to the relevant all the parties at this stage. But I do think it's a thing worth noting. So going back, so I'm going to sort of close out that this item is more for noting because it's an update. And I guess what I've heard, and I think hopefully you've heard, Tim, is that broadly I think the three core strands they match what we are doing as a city, and I feel like there's board support for the ideas of hospital to community, analog to digital, and sickness to prevention. I think those are broadly supported. But I think there's also lots of challenges, and you've raised them, and I think we've echoed them around health being wider than the NHS, around the challenge for colleagues around all the change, around the funding, and so on and so on. And so I think there's a lot still to do. And so I guess what I think probably where we are is you're still in a transition phase, and we may need you back at some point to give us another update because it's a 10-year plan, as we said. It feels like we're still very early in the journey, and before we haven't sort of, I guess, if you're thinking about driving on a journey on a motorway, you go down this slip road as you get up to speed, and then you sort of reach a steady state, and it feels like we're still in that acceleration phase, and so lots of change still happening. So thank you very much for coming and being honest and answering all our questions, and I think we're going to close that item there. So thanks for your time. Thank you. Thank you. Okay, so we're going to move on to item 8, which is the Victoria's item. I think people are just coming up to the table, so I'm just going to give them a couple of seconds to come to the table, and they get their microphones plugged in. Councillor Venner, do you want to make some introductory remarks? Do you want to introduce yourself, make some remarks, and I'll ask the three colleagues to introduce themselves?
Sorry, I was late.
I'm Councillor Fiona Venner. I'm the Cabinet Member for Equality, Health and Wellbeing. I'll tell you the reason I was late because it's health related and interesting. So in my ward, there's a table tennis club called Leeds Parky Ping, which is for people with Parkinson's. And it's fascinatingly, it's a medically researched phenomena that table tennis reduces the symptoms of Parkinson's. So there's a global network of Parkinson's players across the world who play table tennis. And I was late because some Japanese people came to my ward to people with Parkinson's from Japan who play table tennis came to visit Leeds Parky Ping. So I was just saying hello to them and giving them some little Lord Mayor badges as a present from Leeds. They've just been to Manchester, so I was making sure that they knew Leeds was far superior. Anyway, I'm sorry I'm late, and I'll make some comments on Victoria's paper. So this is the annual DPH report, which it's a statutory requirement for Victoria as the Director of Public Health to produce the report. This report's been really well received everywhere we've taken it. And I think it's quite an unusual DPH report in focusing on an area we wouldn't necessarily think about as being a health issue. So I think people wouldn't necessarily think about heat as a health issue, particularly in this country where we're famed for rain and bad weather. And not only has it been well received everywhere we've taken it, but the Association of Directors of Public Health have said this is one of the best 5 DPH reports that's been produced this year. And this is the 3rd year in a row that Victoria's report has been identified by them as one of the best in the country. The report obviously pulls out the health inequalities of the issue in terms of older people, children, pregnant women being more at risk of heat, and also particular types of housing like high rises. In terms of getting the messages out to the community, which feels really important, I think we need to kind of convey to the public that heat is a health issue and to develop a culture of people looking after each other the way they do in cold weather. So obviously people are very familiar with the idea of if you've got an elderly neighbour, you might get their shopping for them when it's snowing. Not sure if people necessarily have the same train of thought about heat. So that's the message that we need to get across about people in the community needing support in heat the same way they do when it's very cold. We also need to think about developing cool spaces across the city in the same way we have warm spaces in the winter. And that may involve liaison with a variety of sectors. So Victoria and I had a conversation recently about how nice and cool old churches are in the winter, so in the summer. So I mean they're cool in the winter as well, but so that might be a sector we can look at in terms of developing cool spaces. We also talked when I brought this paper to Cabinet about working with our neighbourhood networks, because a lot of them were formed around cold and around support for older people through winter. But actually, similarly, we need to be working with organisations that support older people for them to start thinking about heat in the same way they think about cold as a risk and needing support. And I was really surprised by some of the things in this report, like it's 8 degrees warmer in the centre of Leeds than in the outskirts. So again, that's part of the health inequalities part of this paper, that people in the inner city urban areas are more at risk of extreme heat than people in outer areas. But those are my comments, Chair. I'm really happy to hand over to Victoria to add anything, and then we can take questions.
Thank you, Councillor Venner. I'm just going to ask the colleagues that arrived at the table to introduce themselves.
Hi, it's Dawn Bailey, Consultant in Public Health and Chief Officer here in the Council.
Hi, my name's Hannah Sauberts, Head of Public Health for Health Protection.
Hi, my name's Helen Laird. I'm the Head of Public Health for Ageing Well and was involved in the report last year.
Thank you very much. OK, over to you, Victoria. I think you've got some slides, is that right?
Thank you, yes, and thanks for the opportunity to bring the report here today. I'm delighted to be here with my colleagues who've been very involved in it. And thank you to Councillor Benny for those opening comments. It did feel like we were taking a bit of a risk with this one, and particularly when you make the decision in January, February to go for something like this, kind of not really knowing how the year would play out. And we're gonna try and play the film in a minute. Fingers crossed it works. And we needed to film this in February in the city, so that was a little bit of a challenge. But yeah, so it's great that it has been well received, and obviously it's been good to land it in the middle of summer, and obviously we've statistically now had the hottest year ever on record, so obviously that helps the context. So I have got a slide share. Angela's going to do the forward bit. I want to get through this quite quickly because I'm really mindful that the most important thing is the conversation afterwards. So apologies, I'm going to whistle through these slides quite quickly. Chair, I believe we are going to have the opportunity to see the film as part of the slide set, which is great. The film is about 6 minutes long, so it's great that we can show it here today. And then I'll just pull out some key points through a handful of slides, and then we can have the questions and the conversation. The reason why my colleague Helen Laird is here with me this afternoon is that we were asked not just to present this year's report, but to also give a brief update on the progress on last year's report, which was on Ageing Well, which is the reason why Helen's here, because she leads that work. So Helen's going to do a quick couple of minutes on what's happened with last year's report. So happy to take questions on both of those. Thank you. So I've just say on this one briefly, Angela, what we did, just as a, can you go back to that slide before? Just to remind the board that what we do every year, which hopefully feels to be a working formula, is to use an approach which takes into account published evidence on the issue, but with a very, very strong focus on listening to people who live locally and have lived experience of the issue. So we have listened to people, particularly in the groups of highest risk around health. And also we've listened to frontline professionals about their particular perspectives on the issue, and then brought that all together into the findings of the report. The other thing to say by means of introduction is that since we took the decision to go with this report, my colleagues will testify that there's been such a huge amount of interest, and this agenda is moving on at pace with lots of partners. So our academic colleagues at the University of Leeds and some of the other local universities have become much more active in this space. Even over the last 12 months, we've got a huge amount of requests for conversations from colleagues involved in climate committees, etc. So there is it's a fast-growing agenda around the impact of heat on health. So I think, Angela, if we can try and fingers crossed the video works. Play this. Thank you.
Leeds is a city of resilience.
A city filled with people who adapt,
cope and thrive.
But as temperatures rise,
we want to show you what it means to live
in a warming city.
So these
are our stories in our own words.
Temperatures soar to a record high.
Scientists have warned urban areas are at a higher risk of heat.
Met Office has issued the first ever red warning for exceptional heat.
Leeds records a scorching 40.3 degrees Celsius, which is a new high.
Tick threat. UK braces for rising disease risks amid climate change.
In this heat, it's hard to stay comfortable. It can be depressing when you're stuck in your flat. I do have my fan and water in the fridge, so I can still try my best to look after myself and keep hydrated. Small walks help, but not everyone here can do that. Having a comfortable outdoor space would make a big difference, a little spot we can all share.
A lot of buildings in Leeds were designed to keep the heat in, so in the summer they get very warm, and it's not always easy to find a cool spot. A couple of summers ago, the heat was like nothing I'd ever experienced before. I don't mind warm weather, but when it gets too hot, it slows you down. I have a chest condition, so I have to be careful. I keep my house well ventilated, use a fan, and stay indoors when it's really hot. It clearly will depend on living circumstances, won't it? We're blessed in living at street level rather than in a high-rise block. That'll make a difference. I mean, my chest condition is such that I can get out of puff when I walk uphill, perhaps more so in hotter weather. Our church is a great place to go when it's hot. It's cool inside and it makes a real difference. I'm lucky to have Roundy Park on my doorstep too. If there's a breeze, it's a great place to be.
Some nights it's hard to sleep because the house just holds on to the heat. It makes the air feel heavy, and even during the day, it's tough to concentrate. When it gets really hot, you notice how much harder everything feels. Not having a garden means the park is the only place to cool down. So I go there and meet my friends when it's hot. Even there though, there's not always enough shade.
We live in a flat in the city centre. We don't have access to a garden. When it's hot, we make the most of the balcony. We try to have our meals outside just to get some fresh air. There are great green spaces in Leeds if you can travel. It's a lifeline for my kids, but even here, we have to work to stay cool. I try to find a breeze and remind my son to drink enough water. In the heat, I feel so tired, my mood is low, but what can I do? I work, I'm a mom, I can change my routine. Climate change is coming fast, but I want to do what I can. We try to make small changes, reducing waste, cutting energy use, because this is the future where my kids will grow up.
The heat affects everyone. The children who never used to nap during the day, they need to sleep, and parents feel completely worn out. As our outdoor area gets too hot, we adjust activities, take extra water breaks, and help families find ways to stay cool. We also advise parents not to put blankets over the buggies, as this can create heat traps. Not every family can afford day trips to escape the heat, so we organise group outings to make sure all children get the chance to enjoy fresh air and space to play. We also do things like refer families to clothing banks for summer clothes.
I volunteer at a charity, and we see how much of a space like this really matters when it gets hot. Some people don't have anywhere cool to go, so having places like this where they can get out of the heat, have a drink and make friends and just feel comfortable is really important. We're doing small things that make a difference. We planted 18 trees last week, which will provide fruit but also cool the environment. It's about looking out for each other. But it's not just here. Projects and spaces across Leeds are making a difference. If more spaces like this existed across the city, it would help so many people. It's not just about now. It's making sure that Leeds is ready for the future.
When it's hot, I feel lethargic, but I've always known to drink more water and stay in the shade. The staff here are fantastic. They check on us, bring us extra drinks, and do what they can to keep us comfortable, even though it can be difficult to keep the rooms cool. Summers used to be hot, then they'd cool down, but now it feels more extreme. It makes you think about what's coming next, especially to my grandchildren. But I try not to worry too much. We've always found ways to adapt, and we'll continue doing that.
As temperatures rise,
cities like Leeds face unique challenges.
Each of us has a part to play.
Through small actions and shared effort,
we can build a more resilient future for everyone.
Thank you. So we'll crack on with the rest of the slides and keep the voices of our local residents at the centre of the presentation. So I'll take the reports as read. You've got them in your pack. I'll whiz through the rest of the slide set. John's going to come in with a few comments on a couple of points. This slide really summarises the headlines around increasing temperatures in our city. So the bar chart at the bottom really demonstrates that quite powerfully, and only goes up to 2022. So we know that we've had hot years, including this year, since then. So there's no doubt that the city is warming, and there's some more detail on that in the report. Next slide, please, Angela. You may have seen this in the reports. It's the one slide. If we only had one slide to share with anybody, we'd choose to quickly talk to. Basically, this makes the case really clearly in my mind around why we need to take this seriously around impact on health. Often when we talk about heat and health, people are not always convinced around how serious the issue is. But this slide feels very powerful. Basically, the red line, this is the line, the graphs are showing daily deaths. This is for England. So the red line is the average, 5-year average of daily deaths each day of the year. And we see the red line going up in the winter period because we're very familiar with more daily deaths in the winter period, hence all the work we do on cold and protecting people from cold harms. What the blue line shows is 1 year, which was 2022, when we did have the very hot temperatures in July. And you'll see that the day with the highest deaths ever recorded is the 19th of July, 2022, which is when we hit that 40-degree temperature in Leeds and across the UK generally. So that there was on a single day there was over 2,000 deaths in England, and that would play out proportionally for Leeds. So we know that actually there is a spike of deaths when we get high temperatures. We also know that underneath those deaths are a huge amount of contact with NHS services for people who are struggling for all sorts of reasons with heat. And when we look into the presentations, often it's things that we wouldn't normally expect. So as well as the usual respiratory conditions and heart conditions, there's a lot of mental health. There's a lot of mental health consultations there, and a lot of violence-related presentations. So we know about the broader impact of heat on health, as well as this that very powerfully shows the deaths. Dawn, do you want to briefly comment on this?
Yes, so as I'm sure you're all very aware, we're really well rehearsed as a city in implementing actions during winter to keep people well and warm. We implement actions from the UK Health Security Agency Adverse Weather Plan. I've been here a few times talking about what we've done over a winter period with many of you in that conversation. I think one of the recommendations that we'll go on to talk about is how we need to get better at implementing the actions from that plan around keeping people well and cool during the heat or during hot weather over the summer periods, and particularly in spikes, as we've just seen here. So that's one of this is some of the evidence that we've used to inform the recommendations at the end.
Sorry. Just to say, there's a whole load of quotes from what our community told us, particularly people in high risk groups, about the impact of heat on their health. Next slide, Angela. And the same for our frontline professionals. And there was quite a lot of overlap there, which again have gone on to inform the recommendations. Next slide, please, Angela. This is in the report. This slide just summarises some of the headlines around those higher risk groups. So we know that heat doesn't affect everybody equally. depending on where you live, depending on how old you are, and depending if you've got underlying health conditions, you are more at risk. And we know that we have lots of people with multiple risks, and obviously when that combined, the risk is much higher. So there's some broad numbers there and how that relates to Leeds as a city. Next slide, Angela. And this is what Councillor Veniver was referring to before. People might be familiar with the concept of an urban heat island, where highly built up urban areas actually hold heat much more efficiently than more rural areas. So even if we are 2/3 countryside as a city, we've got that difference across the city, just depending on the physical space that people live in. And interestingly, our Met Office station that gives you the temperature for Leeds is in Bramham. So if you're getting a Leeds temperature, it's a Bramham temperature, and on average, it's around 8 degrees higher when we take it right to the heart of the city centre on a hot day. So that was important for us to think about. Next slide, Angela. And with colleagues at Leeds University, we've used some of this evidence to look at a climate vulnerability map for the people of the city. This is just based on the geography of where people live and the impact of some of those factors around the heat islands and the physical environment. Obviously, this will be overlain by personal characteristics such as age and state of health. But to get to this level of granularity for our city is the level we really need to get to in order to think about actually how and who we work with and what needs to happen in different geographies across the city. Next slide, please, Angela. I won't dwell on this one, but there are some parts of the report that look at particular specific risks, but the two that come through are around vector-borne disease. So we're starting to see new infections coming to us with the warmer air, and there's a lot of work with our colleagues in the UK Health Security Agency in managing those emerging risks, and also in terms of air quality and the impact of heat on air quality across the city. Again, we're doing lots of work with our UKHSA colleagues on that. So to summarise, key findings of the report, we know we have rising temperatures in Leeds. We know that this has a demonstrable impact on hospital admissions as well as mortality and use of health services generally. We know that the impact of heat is unequal because of the reasons already talked about. And we know that for lots of people, they will have that cumulative impact of multiple risk factors. So just in terms of the recommendations, hopefully you've all had a chance to look at those. We haven't got time to go through those now. Obviously happy to have conversations about them, but they are recommendations to the whole city and whole system. Dawn was just going to pull out a couple.
Yeah. So there's 9 recommendations. I'll just give an overview. The first recommendation is for the whole system to consider the actions in the UK Health Security Agency Adverse Weather Plan. As I mentioned, really used to implementing actions during cold weather. We need to consider how we implement those actions during hot weather to keep people safe, particularly those most at risk. I think that's the first recommendation, and the one that we really need to consider, and have had some conversations already within partnership meetings over the last few weeks. We've got recommendations as well around improving access to cool spaces. You saw in the video around some ideas and things that people are already doing. We need to look at improving that going forward. We've had some really I think positive conversations with partners about ways in which we can do that. We have had a lot of conversations with our university partners in the development of this report. There's been a huge amount of positive conversations about joint working we can do, joint bids we can put in together. So as well as all of the intelligence, evidence base that they have that they can use to support us working together to implement this plan, we I'm really positive in the way in which we can develop on that going forward. So I think that feels really exciting. And we've got some very specific examples we can talk about. And then other things to talk about include the strengthening relationship that we have with planning, looking to see how we can increase resilience within our buildings going forward over the next 10 years to protect those most at risk. Final thing I'll pick out is the work that we need to do with the workforce, our wider workforce, and ensuring that people, frontline workers, are really confident in supporting people to keep well and cool during the hot weather. And there's a lot of work we've done already, but we can really build on that to strengthen that over the city. So there's a few more recommendations in there, but they're the main ones I wanted to pull out.
Sorry, I do apologise. You think I'd know by now. Very quickly, Helen will just spend a couple of minutes, mindful of time, but happy to pick up on any questions on last year's report as well. Helen.
Real, thank you. And as Victoria mentioned earlier, the progress update is provided in the full Director of Public Health report this year, but wanted to kind of give a few highlights of the many things that we've been doing since we published the report. And just to remind people that the recommendations here were focused on actions that we can take to support people to spend more time in good health in later life. So some of those highlights are that we've reviewed our age-friendly Leeds strategy and action plan, which the Director of Public Health annual report and insight and data in that provided fantastic evidence to support that review. As part of this, we've really successfully engaged a range of new partners who have committed actions in the plan around supporting the ambition to be an age-friendly city. And the benefit of kind of the report informing the age-friendly strategies that we have now, an age-friendly strategy that's a 5-year strategy, so that ensures the longevity of the recommendations in the Director of Public Health report. Supporting this, Leeds Older People's Forum have signed up more than 250 age-friendly organisations and 400 age-friendly ambassadors, with 90 across each of these over the last year since we published the report, so an area of work that's continually expanding. And we're supported in kind of raising the profile of our age-friendly work as it's now a priority in the Best City Ambition review, so keen to see increased focus on that. In terms of developing ways to support people to keep active, we've been working with a broad range of partners to review and develop ways to keep citizens active, and have identified 3 goals to focus on in terms of progressing that work. I won't go into a lot of detail, but just to emphasise, we are going to be working with partners over the next few months to look at how they can contribute towards supporting that action. Also want to mention the work that we've been doing around alcohol and ageing. So the report really did shine a light on some of the needs in the city around alcohol and ageing. So Forward Leeds have been developing some resources and information and training to really raise the profile around alcohol and ageing, making sure that we spread that across our partners across the city, across the health and care system too. And we've been having lots of conversations around that with partners. We've been doing lots around embedding social connections into policies and services. A couple of examples around our Creative Healthy Ageing programme, which in the first year has proven to improve socialisation and build connections amongst partners. A couple of other examples in terms of policy is the development of the Leeds local plan, so around developing and embedding age-friendly principles to ensure that the built environment supports people to age well as they grow older. Couple of other more health-facing examples. So there's some focus work in community settings around increasing access to NHS health checks in community settings, but also a project which was launched early September with the aim of performing blood pressure checks in communities, again in target communities where blood pressure is high. And also some really exciting work around early identification of people at risk of falls, pinching the learning from Greater Manchester with pride on that one. Lots more to say across all of the recommendations. Just a couple more to flag. Leeds Older People's Forum held last year the International Day of Older People event, which celebrated the contributions of people in later life, addressing some of the stigma that's related to ageing, and which was attended by over 500 people. We've also, over this last year in particular, had real success in engaging the West Yorkshire Combined Authority in relation to the transport areas of our age-friendly strategy. I'm pleased to see that we have actions that they've committed to delivering in the age-friendly plan. So I felt like that was a positive note to end on, but there's much more which we can expand on if needed.
Super, thank you very much for that. And obviously it's important to remember what was done last year to make sure it's not just like a one-off and then we forget about it. So thank you for that, and thanks for the presentation and the film. I was pleased to see Beeston was featured, and I thought it was quite interesting what you said about the time of year it was filmed, because in the cool space everyone was in the air conditioning must be working really well in that building. So I'm going to start bringing people for questions now. So if you want to ask a question, please indicate the usual way. I'm going to start with Councillor Bromley.
Yes, thank you. I really welcome this report, and it feels like a sense of preparing opposed to reactive, so that is really helpful as well. In terms of the video, I thought that was brilliant, and so hopefully that's available for us to share too. I'm really glad that you included a young person's voice in that as well. I just wondered, in terms of our communication with organisations, are we looking as well with the education department, just in that some of the rules sometimes around uniform is like in keeping jumpers on at all times, and regardless of whether we might think it's a bit balmy or we don't have any control of that, are we making sure that we put the information out there to schools a little bit similar to like not putting blankets over a buggy, and are they aware of things like that in terms of education for our young people and their ability for concentration? And also that I really welcome that you'll be working closely with third organisations, and I think I've mentioned this before, but in terms of the local areas, knowing how that they'll be able to support this information, not just with critical thinking and being able to combat with misinformation that may go around, but also be helpful and supportive to people within the community too. Thank you.
Hi. Yeah, in terms of communication, I know we've certainly got really good links with our Healthy Schools team. I know they have kind of promoted some of the main messages within the report. I think you're absolutely right in terms of some of the limitations with influencing some of the school policies. So you've mentioned school uniforms, which is one, but also hydration as well. And, you know, obviously the more we drink, we need the toilet, which is a good thing, but we also know that that can provide a challenge within the school system and policies as well. So we'd welcome any conversations that we could have, you know, to further influence that. But yeah, we've tried to use the relationships that we have via the Healthy Schools team to promote some of the messages. But we are at the beginning of the journey with this.
Thank you. Councillor Bromley, do you have a follow-up?
No, just to note that's spot on as well, and I hadn't thought about the hydration part, and then the toilet visits, which is another contentious conversation, isn't it? Thank you. I'm glad that's been noted.
Yeah, it feels like not a controversial topic, but it does feel like that sometimes in some of the high schools. Yes. Okay, Councillor Holroyd.
Thank you. Just with regards to some of the recommendations you've got, considering the heat and health within planning, as someone that lives in the city centre and has lived in high-rise glass greenhouses quite a lot that are all massive windows and no air conditioning, I think it is a brilliant thing to recommend. But how are we actually letting developers know that we are going to be considering this when planning applications come in and they have all these wonderful glass buildings that look nice, but again, cooling them in the summer is impossible. And also with regards to hydration, you know, we're encouraging people to drink more and go out and walks and things, but if you're out and about, are we working with third parties and things to maybe look at a way where they can call into somewhere and fill their water bottles up? Because we don't obviously have drinks fountains out in public spaces or anything. Is there anything we're looking at to do with hydration, how we can fill our water bottles up at public spaces and things.
Hi. I think when we were developing the recommendations, as you say, planning and what we ask of developers was really key in our minds, and we worked very closely with our planning colleagues to look at the current position and where we'd like to get to. And I think part of that is around what data is available to us in terms of heat mapping. So the map that we showed in the slide deck was produced by some technology that was produced by the Leeds Beckett University as part of some research, but that's not a regularly updated data set. So we need, in order to be able to have a more accurate ward level heat mapping, we need to work with our university colleagues or partners around the city to develop that on a long-term basis, which is a conversation that we're having now alongside colleagues from planning. But there is a commitment to look at what more we can do to ensure that planners have to use more ward level heat mapping data rather than the citywide average, which is what's asked at the moment. Just to take your point around the kind of hydration that and rehydration, I think we're looking at this alongside the Cool Spaces initiative. So cities like Manchester have a Cool Spaces scheme, and they also have the rehydration stations, which are water fountains, which anyone can access. There are other alternatives, which I believe I'm just finding out about it at the moment, but I believe there is an existing hydration map for Leeds at the moment that people can voluntarily register their businesses to. But we're looking at whether that's good enough or whether we could expand on that and have something more formal alongside the Cool Spaces initiative.
Pim? Yeah, thank you very much for that. That's quite encouragingly positive. Thanks for that. Councillor Blackburn?
Staying on the planning theme, I mean, we are currently consulting on Leeds local plan. Has anything from this report gone towards planning to go into that local plan? And then, if I can just ask as well, I mean, as you say, we do a lot during winter about keeping people warm, but I think what we need to do, we need to get this message out to everybody. So can I suggest that this report is sent to all the people that are champions to do with elderly people and health and that at the community committees, and possibly try and get on the agenda of each community committees so we can actually address the issue. That's all.
Thank you. Councillor Bennett, do you want to comment?
I'll just pick up that last brief point. Thank you, Chair. So we've got the first meeting coming up of the health champions for each community committee. That's the meeting that I chair, and we do actually have Victoria's report on that agenda. So we will be discussing it and looking at how we get the message out within local areas. And we had already talked about the possibility of what you've suggested, that we go to each community committee. But I'll take advice and thoughts from the champions about the best way forward. But yeah, we are discussing it in that forum. Thank you.
Yeah, Victoria.
Yeah, thank you, Councillor Blackburn, for those comments. They're really helpful. We'll take those away. I think on the point of planning and spatial planning, building design, one of the most telling parts of this process, I think, and Dawn was very involved in lots of these conversations, was going to talk with housing and planning colleagues around this issue. And I think it's fair to say that they were very interested, but they were talking about this not being on the radar, and the whole history of the way we develop and design houses in this country is around cold, keeping people warm, not necessarily keeping people cool. So, and in recommendation 5 around heat and health considered in planning, I mean, that's huge because it feels as if we're right at the beginning of a journey, and we need to get into professionals who are not health professionals but actually buildings professionals and spatial planning professionals, which I'm sure will come. But actually, I think we've started something that As you rightly say, we just don't have a history of looking at building in this country along this issue. So it's been very encouraging, but it feels like that recommendation 5 is around really taking that forward with a group of people who haven't considered this yet as an issue.
I mean, they always said that the further north you get, the worse conditions houses are for being cold. And I think it's true to some extent. But also, a lot of those houses that are cold are warm. Living in a Victorian house, I can tell you this, they're cold in winter and warm in summer. So some of the things you can do to actually deal with cold in winter actually can help insulate you from the heat in the summer as well.
Thank you very much, Councillor Blackburn, for those comments. Okay, Councillor Galton.
Thank you, Chair. That last comment was really opposite to what I wanted to go into, which, because I looked at recommendation number 5, and I'm thinking, well, it's all about providing a better granularity of information, but what's important is what you do with that information. And I wasn't quite clear how that would affect the applications that come before a planning committee in terms of, changing anything in the design. And I recall back to your predecessor, Dr. Cameron, when he did a public health report on housing and its effects on health. And one of the recommendations that came out of that one was that each planning application should go via public health to have comment on whether or not the design was appropriate. And I don't think that ever got implemented. And I think that was more to do with, not from lack of interest, but more about capacity within organisations to do that. And I think it's quite hard to get that practice hardwired. So I appreciate that that's going to be a longer term response for you. One of the things that I think could be shorter term and might also reflect organisations, even within the council, thinking this isn't our core concern and therefore we're not really going to respond. Planning is all about future environment, but as you've pointed out, the current environment that we've got has an effect on the people that live here already. And what we should be doing is trying to improve that situation in some way. And one of the easiest ways to do it is to plant trees. And your report talks about it, and it was in the video as well. However, we don't have a council wholeheartedly that enables trees to be embraced and to be invested in. So we've got a tree planting policy which creates areas of woodland created by whips, which tend to be in areas of margin and are therefore less valuable for things like development or amenity. So that woodland isn't accessible. It's not creating shade for the community. What we need is more trees that are within our communities and on our streets. And highways are not an amenable organisation in my experience. And I would like to see something coming out of this report which gets some kind of behaviour change from that department. Because there was a scheme, Chair, if you don't mind me going into detail, that was called Trees for Streets, and it was an arrangement with an independent organisation which was supposed to be creating more trees on grass verges across the city. Not of much use in inner city areas which don't have grass verges, but it collapsed, Chair, because Highways rejected about over 80% of the applications to plant trees because there might be an issue with undertakings underneath. And I think rather than being risk averse, we should be embracing it and making sure that trees actually happen in our streets. And in terms of housing, Chair, a lot of councillors will know that we get complaints from people in housing estates, especially council housing estates, where they see trees as problems because they're either getting into their eaves or they're just a mess at the bottom because they're not kept well. And if we actually had a scheme within housing where they took the environment that their houses are in as seriously as the integrity and the insulation within the building, we might have happier people because it's a a nicer environment to live within, but we might also have those cool spaces nearer to people so we don't have to spend money commissioning them from outside organisations because the cooling is already within those communities. So I think we really need to be challenging our internal partners to deliver, not just to accept the theory. And I'm happy to have comments on that.
If you've got a response to that, Victoria, feel free.
No, thank you, Councillor Galton, for those comments. Really helpful, and I think that it sums up really the just two key examples of where we want to go with this report and its recommendations. And we're at the beginning of that journey. We're a long way. We're a long way from having that as a kind of an agreed plan, and certainly think that the example you talked about, having public health advice into planning decisions. Obviously, we do it for other things around licensing. It's that I think there's a legitimate conversation about proportionate input, and I'm really keen to have that. I think this is why this report felt like a brave decision, because it gets us into that space where actually this is about looking right across the council at things that aren't normally seen as health related, and actually saying that the impact you have is considerable, and actually we need to work together to make change. I think this is the whole test of, you know, how. Why did we bring public health into local government in 2013 to affect these issues? And actually, it's pushing on the whole council to be, you know, health in all policies, public health organisations. So I think I think I'd agree with everything you've said, and I think that it gets us into the space where we're actually having those challenging conversations across the council, and you know, we want to make progress with those, and that's not quick or easy, but it feels that absolutely the right thing to do. So very much welcome your comments. Thank you.
Thank you, Victoria. Okay, I'm going to bring in Jane next.
Thank you. First of all, yet again another excellent report and fantastic film to hear the voices from the people that live in Leeds. Probably not a surprise what I'm going to kind of comment on really, and that is noticing the unequal impact on children and young people as well as older people. Other colleagues have flagged the risk to older people, but younger people as well, and how that also cuts across that we have a third of our children living in the most deprived areas, and so there's that kind of double impact, living in overcrowded housing, poor access to green space usually, and so I suppose in terms of the recommendations, are there any practical ways that you can start to address that? I mean, it links very clearly to Marmot, of course, but that was my main point. I had a couple of other things, but people have covered them.
I'll start on that. Colleagues might want to come in. Yeah, I think in terms of children and young people specifically and inequality, one of the critical issues, and it relates to the conversation we've just had in relation to Councillor Galton's issues, is about how this plays out for those people in the groups of highest risk, and for example around things like access to safe green space locally. Now we know that's already a priority for the city in, for example, in the child poverty work that we do, and it's part of the Marmot City work around 0 to 5 and beyond. But it's how we use this to push harder on some of those things that are the critical reasons why there is that difference. The reason why we filmed the children that we did was because they were children without a garden, and because we just had Roundy Park. Not everybody lives within walking distance of Roundy Park, so we're really mindful of how this plays out in terms of inequality, and I think the green space one is particularly pertinent there, as is the work around housing, which is another Marmot priority. So I think it, in a way, it gives us another hook to be able to drive that work
with another set of evidence and another set of local people's voices behind it, because it then relates to this agenda. And using the platform of the report, it gives us a platform to actually drive through recommendations, you know, with a bit more weight than kind of things may have already. Or if we can join that together, it gives things even more of a hook to drive forward. So we're really keen to be able to kind of join this up as much as possible with the things that we're already doing. We've also got the Leeds Ambitions that are about to be launched. Obviously, poverty and inequality runs right through those. Health and well-being runs right through those. You know, as well as climate and housing. You know, so you know, I think it's about using this to get more leverage for the things we know we need to do, but actually we can come at this with a compelling set of evidence that actually it will make a difference. You know, with this lens on it. So I don't know if I answered your question there, Jane, but I really welcome the inequalities issue being raised, and we will do everything we can to push this within the things we're already doing as a city.
Thank you, Victoria. Okay, I'm going to bring in Councillor Stevenson next.
Thank you, Chair. Just following up on the points about planning and design, I do probably think there's something more broadly around thinking about air conditioning units, for example. There'll be some who would argue pros and cons about their use, but at present, if you were to install air conditioning, they're rather ugly things to attach onto a house. And if you're in a conservation zone, it creates all sorts of issues. But it's one of those things where, until we grasp it, R&D doesn't catch up. So eventually, a little bit like solar panels, I think 10 years ago, they were very equally ugly things on the top of houses, whereas now they can be engineered in quite a smart way that's in keeping. And I'm sure that air conditioning units can get to that point as well, if we work with other partners in local authorities and planning departments to move ahead, so that we can give confidence to private sector that if they invest, we will use. A quick point on the point of baby blankets were mentioned in there, and I know, being the dad of a now 2-year-old, I was I would say persuaded, but told by my wife, had to spend an extortionate amount of money on buying one of these fancy black cloths that goes over the pram that lets air in and out and ventilation. We've all used them. They are quite expensive, and for the poorest in the city, that might not be an option. So I just wonder, I think, do we still give baby boxes out, I think, to disadvantaged parents? And I wonder whether there's a way we could perhaps look to include those blankets that mesh that we should be using to deter them from using blankets. And then the question was around the stats that were on the daily deaths chart given to us, and I just wonder, I looked through the report, I couldn't find where it delves down who is dying. Is it older people or those with pre-existing conditions? I'm guessing it's the same as came through in the COVID data, for example. And as a result of that, how are we going to target groups that are more vulnerable in order to ensure efficiency? Because that won't necessarily link to the heat map around deprivation, for example, but equally I represent a ward that is most certainly not deprived but has a majority of older people living within it. So how do we make sure we use our resources most efficiently?
Sorry. So relating to your question about who's affected, the people who are affected by deaths from heat or who become unwell through heat does mirror very similarly to those who are affected by cold. We do have the very granular detail, and we can go into that a bit further if you would like. What I would say is that recommendation 1 of the report is about implementing the UK HSA adverse weather plan, and that has very detailed evidence-based high impact interventions to keep people well and cool during those heat waves and during hot weather. So we do have that very strong evidence, and we do know what works in order to keep people safe during hot weather. Do you want to add anything?
Hi, just to add to a few of your points just around planning. I think you're absolutely right in that, new things are coming online all the time in terms of technology. I think there is a recognition that we shouldn't just rely on mechanical cooling and the impact that has on fuel poverty. It's the same as running heaters in cold weather, that actually cooling your house does contribute for some people to fuel poverty as well. So, and that there are lots of other alternatives if we have the technology and the funding for new builds, but also retrofit as well. I know that there's a lot of information that goes out to parents of babies and young children around how to keep well during hot weather through their children's centres and early year providers, through our children and families team within public health. I'm more than happy to share that information with you. I know there's specific detail on recommendations of what not to use and how to keep your baby cool, which is more around sort of removing clothing and keeping cool that way. But more than happy to look at the offer for new parents, especially those living in areas of deprivation.
Thank you very much. Okay, Councillor Gibson.
Thanks, Chair. Just a quick practical question. We do a lot of amazing work like this. And, and we hear about it a lot at the committee, and I'm always like, right, is the word getting out there? I know this has already been touched on. But I looked on Leeds directory and sort of cool spaces isn't on there. I couldn't find warm spaces on there either, never mind cool spaces. So I'm wondering whether we're doing a good enough job of collating all these fantastic things that we're doing and making sure that people are aware and that it's in one easily accessible space, so that, like Leeds directory, so that, people don't have to go, do a lot of work to find it.
I'll thank you, Councillor Gibson. I think, to be clear, we don't currently have a network of cool spaces. We want to develop one, and that's one of the recommendations of the report. We should have warm spaces, and I'll certainly pick that up if they're not being well communicated. But one of the thinking around where and how we develop cool spaces, and if they're the same places or slightly different than our warm spaces, is very live work that's happening on the back of this report with some colleagues from across the council about how we do that and how we work with local communities to get that right. So they're not there yet, and they're fairly. We know Manchester has them, but they're still a fairly new thing. So we'll take that away. But definitely, thank you for the point.
Do you want to come back, Councillor Gibson?
Just again, it's just practically. So when the Leeds, I've just gone on Leeds Spaces now and typed in the search bar for warm spaces, and I think yoga spaces is the first thing that comes up. So I'm just flagging. I don't know whether the algorithm's busted or I don't know what's going on.
I think they've been rebranded as welcome spaces rather than warm spaces and cool spaces. So, yeah, absolutely. Yeah.
So I think that's something we can take away, or you can take away. But I think that's a really valid point. Thank you, Councillor Gibson. Okay, Councillor Buckley.
Yes, what I want to talk about is you talk about lobbying for improvement in national policy around rental housing so that landlords are responsible for making improvements. I'm all in favour of all these things. Do you think because of increased legislation this would have an adverse effect on rental accommodation being available, particularly for the smaller landlords who might not be willing to conform to increased legislation. Therefore, it then shifts the problem onto people not being able to buy rental property if the legislation is too strict on the climate change aspect of housing policy, of the policy. Do you understand what I mean? What I mean is, if you have legislation already in place for landlords and you increase it, some of them will not be happy with that.
Well, they might not be happy, Councillor Buckley, but frankly, we do need to improve the quality of private sector housing. And there's been a raft of legislation that's come in over the past couple of years to do that, some of which brought in under the last government, such as Awab's Law, which was addressing the desperate need to improve the quality of housing after the death of Awab Ishak in Rochdale. Actually, that was in social housing, not private rented, but nevertheless, the legislation that brought in was about the need to have housing that doesn't damage people's health to the extent of a fatality in that really tragic case. Similarly, we need legislation that is about housing, that's appropriately insulated and insulated against warm and cold. So it is really important that the government does legislate to improve both the security of housing in the private rented sector, which is happening through the Renters Reform Bill, but also that there is legislation that recognises the fact that we are in a climate emergency, and that means that housing has to be better quality. So personally, I am absolutely in favour of legislating if it means that people's health is preserved and people live more comfortably, in a warming environment.
Thanks for that response, Councillor Venner. Okay, I can't see anyone else indicating. Do you want to really quick? Yep, Councillor Bromley.
Thank you. Just to add on to that, are we actually looking at other countries? It almost seems wise to be looking at how other countries that are warmer anyway have dealt with things over the years. And also, I know that there's been some impact potentially over tourism, working hours being lengthened, and so how they've previously done things have changed, and has they seen a health difference from that and an impact? Just as a thought.
Yeah, and that's a really good question, Councillor Bromley, because there's also countries that have wider ranges of temperatures. So you think about Canada, for example, gets very, very, very cold, but also gets pretty warm in the summer, so you need it both ways.
So just briefly, Chair, thank you, Councillor Bromley, for that comment. And I think the short answer is yes, we are looking at that. But we need to do much more around it. I think the other example of where other countries' practice is being looked to is very much about the risks to workers and heat. And in countries with hotter summers than us currently, different examples like different shift patterns for people with outdoor jobs are very much being looked at. We've had conversations across the corporate leadership of the council about how this might apply to outdoor workers within the council, for example. So I think both with housing and with employment and the risk to workers, we're looking to other places to look at what's best practice. Thank you.
Thank you very much for that. Okay, so I've got to the end of the questions. I think it's just worth so firstly, thank you very much. I think it's a really useful report, and there's lots of good recommendations. There's also a lot of work that's already happening, but will continue to happen. I've just made a few notes of some of the things I think that's been said, which isn't necessarily explicit in the report, which I think is worth noting for all of us, and maybe worth including in future work programmes, some of which it already is. So, for example, places to fill up our water bottles as we go around the city. I think that's a really important thing. I think there's something around tree maintenance. So if we're going to continue to invest in trees like any asset, you need to maintain it. And I think that's a valid and important point. I think there's something around the baby meshes. I think that's, again, our youngest and our oldest are most vulnerable. And I think particularly newborn babies really can be at risk of heat issues. I think the point around collating information, I think that's also important. Something I'd had on my list, which isn't in your thing, that specifically is encouraging the council's house improvement programme, particularly the council flats and council houses, what can be done there, particularly to council flats. Are there any other specific points that we think we need to tease out? So I'll bring in Councillor Taylor, but if other members think, there's something I've said or should be said.
Yeah, I was going to say it, but I just withdraw my question. But a couple of years ago, we had for the elderly sit and rest with businesses. Where is it still going? Because if we are encouraging the elderly, you mentioned when they have a lot of fluid, they want to go to the toilet. So while they're out and about, what facilities are out there for them to use?
Yeah, so that fits under Leeds Older People's Friendly Communities programme, so as part of engaging businesses and organisations in the city to be age and dementia friendly. One of the actions that they ask businesses to take is the Come In and Rest scheme, so yes, that's still functioning in the city.
Yes, it feels like that's one of the collating the information pieces that is important.
Yeah, it says that in mind a lot of the businesses are not there what was there. Are you looking at the new businesses to replace the old businesses that come? Because since the pandemic, a lot of business faded. So there have been new businesses in place.
I don't know the answer to that specifically, but certainly I can have a conversation with Leeds Older People's Forum about how they are dealing with businesses that were previously engaged through the scheme that have maybe gone as a result of the pandemic and how we replace them.
Thank you very much. So, other than the sort of suggestions I made in terms of sort of additional things that we've said as a board, is anything else that people want to? Are people happy with the things I've said? Taking some nods. So thank you very much for that. With that, I'm going to close this item. Really appreciate everyone's input, and I feel like we've had a helpful conversation. Hopefully, made you think a bit more about what you've done as well, which is good. I think it gets to go to exec board after us. So there you go. Parity of esteem is alive and well in Leeds City Council. Okay, so I'm going to move on to the work schedule. So people who are not part of the board, you don't need to stay for this part, but you're welcome to because it's a public meeting. Are there any comments on the work programme? I can't see anyone indicating, so that we'll note that. And then the next meeting is on Tuesday the 14th of October at 1:30 p.m. So with that, I'd like to thank everyone for their participation, particularly the guests. I felt like we've had a good and helpful discussion again today, and I'll see you all next time.